share our screen. And I am joined as well with my colleague Silverio. So we're both moderating this session. So hello to everyone. My name is Maria, as Olivia mentioned, and I'm the Clinical Education Advisor at Body Interact. And I'll pass the word to Silverio for presentations as well.
So thank you very much, Olivia. Thank you very much, Maria. Welcome. Good afternoon to everybody. Welcome to this learning lab from virtual patients from high schools, community college towards nursing and medical degrees. It will be a session that will be a mediated discussion about the benefits of introducing Body Interact virtual patients in an early stage of the learning journey of each student and each educator. The educator's challenge today, it is recognize the importance of introducing virtual patients in the curriculum and also apply key content to attract students' attention through virtual patient exposure. Using the Body Interact, the future healthcare professionals experience a real-life healthcare exposure in a safety environment. We will have speakers from United States, Canada, Mexico, and Italy. Once the digital learners are different from previous generations, we also have a testimonial from the student that makes all the sense also have inside this conference. It will be a student from Italy. Let me address a special thanks for all the speakers and obviously also to all the attendees. We will ask you to put the questions on the chat box. At the end of the all presentations, we will share each question to each presenter and they will answer to all the questions that we received also from the audience. So welcome again, and the stage is yours, Maria, in order to introduce the speakers.
Thank you very much. I was then given the honor to present our remarkable panel of speakers. Unfortunately, due to unforeseen reasons, our speaker, Mr. Clark Imus from the EMS department, will no longer attend today, so we apologize for that. But we have, again, a remarkable panel that will be with us today. I'll start by introducing Dr. Tina Garza. Dr. Tina is the principal of Arlington School of Health Professions in Texas, US, located in Rio Grande Valley. And Dr. Tina has been in the field of education for the last 27 years, constantly working to promote impactful experiences among her 450 students, I would say, from grades that vary from 8th grade to 12th grade. And also to join Dr. Tina from the same institution, we have Miss Lily Conde, educator at this institution, as mentioned, that has been in the healthcare field for the last 15 years and recently named in 2020 Texas Health Occupation Association Outstanding New Teacher of the Year. So congratulations for that as well. Following these two presentations, we will have Miss Lorraine Batts, a nursing professor and academic simulation coordinator at George Brown College in Canada. And Miss Lorraine has about 18 years of practice as a bedside nurse. And obviously as a nursing professor, has been working in the simulation field for a long time, having as well a certified healthcare simulation certification, being a member of the Society for Simulation in Healthcare, and also a member of International Nursing Association for Clinical and Simulation Learning and Simulation Canada. Not to mention all the several publications that has, and also all the opportunities that throughout these years have had to speak both nationally and internationally. So a welcome as well. Following, we will have Professor Carlos Aguilar, a National Director of Medicine and Dentistry for the University of Valle del Mexico in Mexico. Dr. Carlos Aguilar is also a surgeon and it has also been involved in simulation, being as well a certified educator in clinical simulation, and not to mention as well all the recognitions both at the professional level and also on the academical level. So it's a great honor as well to have him on board. Lastly, but not least, we will have Mr. Scholl Gordon, a fifth-year medical student at University of Pavia in Italy. And obviously to give us, and is important and obviously important for us to have a different perspective, not only from the educator side, but also from a student perspective that can be telling us the impact of this type of softwares in their learning pathway. To mention as well that Mr. Scholl Gordon is also the president of the Harvey Medical Society and a big passionate about medicine education and medical education. So I will stop sharing my screen and I will now pass the word to Dr. Tina Garza.
Thank you very much. I appreciate this opportunity to present to you. We are down in the Rio Grande Valley at the southernmost tip of Texas, and we have been on this journey with Body Interact for a few years. And so this is our 7th year that we've been in work with our students. And so I'm excited to show you the bits and pieces that we have instilled in our programming to create that pipeline that Maria and Silverio talked about, and how critical this exposure is on their journey. So at our particular campus, we start with our students in 8th grade. And so this is a 5-year journey that they take with us, starting from the basics of the principles of health science and migrating them all the way to their practicum experience. Along the way, students are allowed to dive into different areas that we offer here at the school. They're very broad. We have pharmacology, we have an opportunity for therapeutic services, surgical procedures that gives them more of that clinical aspect, dental science. We also have patient care, and we offer biomedical sciences. So students actually get to try each of these areas as long as they progress through our particular curriculum. We still offer the core academic areas, but this is the special reason they join us. That decision that they decide and where their juncture occurs is their 11th grade year. And that's when they actually pick a particular pathway. Body Interact has been very critical because the majority of our students are wanting to do a PA track or work in nursing or something along the medical field. So we've been able to embed that experience in there along the way and then really solidify and hone on that 11th grade year, preparing them for their practicum experience. Ms. Conde will elaborate a little bit more on that. I just wanted to give you kind of the foundational premise because she's actually the lead teacher who works very closely with those particular students at that point in time. So part of our mantra here at our campus is about getting and creating our students and starting that culture, inspiring them to continue on this journey that they have to become the best health professionals that they can be. So the academic part is very important, but that soft skills piece is something that we have received feedback on from different institutions that our students have progressed into. And we continue to embed that throughout all of their experiences here at the school. So the academics is important because we do want them to be able to have, that high academic achievement, but that soft skill piece is very critical. Character development is critical here at our school. We talk about self-awareness, we talk about the tenacity that they need. And so we actually have a program here in our school, in addition to these virtual pieces, that is called Character Strong, that embeds opportunities to get students familiar with doing those things, because of course, working collaboratively is one of the most important things that we can do as healthcare professionals when we're working on patients. So we start all of that preliminary experience early on, and Body Interact complements that. So before they come to us, so you're thinking, okay, maybe they're 8th graders and they haven't really decided that this is for them. We have now extended this pipeline program down to 5th grade. And so we actually have students coming into our campuses, experiencing the application process, experiencing interviews, being able to advocate for themselves. And we've done that by partnering with specific campuses across the district. we have created a program that has a monthly engagement with our students and a community partner. It's led by our students. So again, starting to get them out and being in more of a leadership role. And then again, having experiences embedded throughout those engagements that starts to expose them to the Body Interact software. So that pipeline is important. Our district realized the value in that, and now as a result have created a middle school experience that is called STEM Squared Preparatory Academy. We do the science, technology, engineering, math, and now we've added the medical, hence the M squared. So those particular students as well continue that particular exposure, giving them access to, of course, the simulation piece, because as Silverio mentioned, it's very critical that we get that piece right before we move into actually interacting with patients. So again, we embed experiences and opportunities to continue to help them solidify and refine those skills that we find are so critical that they have as they venture into post-secondary. So I'm going to hand it off to Ms. Conde because this is her area of expertise. I lead the campus, but it's these amazing individuals that we have in our space that start to create those connections between our students and our community partners. So Ms. Conde, if you don't mind.
Yes, thank you. Okay, so our collaborators every year on our campus is important in preparing our students to work alongside our community partners. And you can see we have a beautiful list of amazing partners that allow our students to come in and get that hands-on experience throughout Harlingen. So as Mrs. Garza mentioned, we do introduce the Body Interact table to our students as young as 5th grade. And this allows for continuous growth to occur as our students progress through our campuses. It is very common for us to cover the didactic portion of a lesson and then transition into using the table to provide our students with the opportunity to simulate the skills that they just learned. And it can be anything from studying an EKG to administering proper dosages of medications to requesting tests or scans on the Body Interact table. And this allows our students to think critically and collaborate with their peers, and that's super important for us. So with that, it's because of opportunities and preparation our students have using a simulation tool like Body Interact that helps make them helps them create real world connections in the material that we're covering with them. An amazing aspect to what Body Interact is doing is allowing us to collaborate with them and create some of the cases that are being used by our students. This helps our students not only think critically, but it also creates those stressful situations that they will experience in a healthcare setting because of time constraints that we can place on those cases. And it's really neat to see our students work under that pressure and grow every time they open up a new case. So it's a really, really amazing experience, and that then helps them transition so much smoother into the community and into a setting where they are actually working on patients. And you can see these are some pictures that we have of our students that are working out in the community and being able to get that hands-on experience after being able to practice on the Body Interact table. So another really important aspect to what we do is part of the preparation process includes training our students as early as 8th grade in proper CPR techniques. And as seniors, our 12th grade students, they all hold a basic life support CPR certification. They not only hold this certification, but they are so confident in their skills that they go on to help host trainings for our younger students throughout the district. And it's really amazing to watch. You know, I always talk to our students about, I know you all know how to wash your hands. I know you know how to do CPR, but we're doing it again and let's get it done. So it's really neat, and it's amazing to see that growth in our students when, you know, we put them out in the community and we can just sit back and watch. It's a beautiful sight to see when we can get them to do these exercises out there for our students. So our LVN students, Body Interact is a huge aspect to our LVN cohort classes right now. Our students use more complex scenarios and they utilize the table to continue to grow throughout their program, and they study those cases. And you know, sometimes in the beginning they might have a little bit of difficulty, but as they work together and they continue their program, they advance so well. And we have them use the Interact table to help them get ready for the real world situation. And again, it makes that transition so much smoother because they can think critically in that time constraint. And so it's pretty amazing to watch. And so here, as a district, we work on developing the 4 C's within our students. So those 4 C's are communication, collaboration, creativity, and critical thinking. Our students host clinics on and off campus. They travel to elementary schools to help teach our younger generation of students. And now that we have our pipeline program with our 5th graders, these kids are being introduced to medicine as early as 5th grade. And it's so important because, you know, they are our future healthcare professionals, and introducing them early, and it allows them to really understand and know if that's something that they want to proceed with. Our campus is intentionally fused with experiences that allow our students to demonstrate the skills they have obtained. This culminating experience helps solidify their dedication to becoming healthcare professionals. The whole experience on our campus is about the discovery of their future, and they have a strong hold of what they want to do when they graduate. And so whether it's pursue medicine or maybe transition into another field, it's a really good opportunity for them because they learn early on what it is they want to do for the rest of their lives, and they did it in a amazing environment that helps them learn and make mistakes and learn from those mistakes. So and it's things like Body Interact that help give us the opportunities for our students. And so this is just our social media pages. We highly encourage anyone who would like to follow us to get a little more insight on what we're doing every day on our campus. And we also have our email addresses if anyone would like to reach out to us and ask us any more questions. I know we'll have some opportunity to answer any questions anyone may have at the end of the presentations, but thank you all so much.
Absolutely. Thank you guys. We appreciate the opportunity to showcase what we're doing down here in the Little Rio Grande Valley, and we look forward to answering your questions.
Yes,
thank you, Maria.
Thank you so much. I'm very much hoping for those questions at the end of our sessions. So looking forward for this. I'm constantly amazed when I listen about your what you're doing in your campus, and it's truly inspirational, the experience that you provide to your students, and I just wish we could replicate that, you know, worldwide. So I'm glad that we're presenting this, you know, to so many people, so, you know, from different parts of the world, because your example, your experience, it's absolutely fascinating. And me being a nurse in my early days, I want to go back to my 5th grade and apply in your school and be at your school. So thank you so much for your experience and for sharing that with us. It's truly inspirational. I will pass now the word to Miss Lorraine Betts to give us an insight as well about, you know, when after they graduate from a school such as yours, for example, that they then move in to a nursing degree. Thank you very much.
Sorry.
No, take your time.
So hello, everyone. And thank you, Maria and Severia, for inviting me to talk today. Fascinating. Wish I had the students from your school, Tina, and that, so that we could have them in our program, because it does really makes it a little bit easier. I am going to share with you today our experience using virtual patients from the community perspective. I just wanted to say I have no conflicts and nothing to disclose. So this right here is George Brown College, or the campuses. So George Brown College is located in Toronto, Canada. We have 3 campuses, and this campus right here happens to be the one I work at, right on the lake. It's the Waterfront Campus. It houses our health sciences programs, including nursing. In the School of Nursing, we have 4 undergraduate nursing programs and 5 postgraduate nursing programs. And our simulation center is actually located on the 4th floor of this building. I want to give you an idea of what our sim center looks like. So we have a 20,000 square foot sim center. We have within that center, we have 5 classrooms with tables and chairs. We have a lab room, 5 lab rooms that have 12 beds in each classroom, where the nursing students will practice their basic skills. Then we move on into our simulation center, and within our high fidelity simulation center, we have an operating room that actually has a classroom that sits back in here that they can look into the OR with. We have its own control room, and as you can see, it's set up to do some kind of major surgery on some kind of a patient there. Then we have our high fidelity sim suites. We have 4 of them. Of the 4, each one of them suites, each one of them has a patient room, an ante room, and a debriefing room. And we have 2 control rooms that link up, 2 on each side of our center that links up to each one of these high fidelity areas. We also have an apartment that has, for our personal support worker program, that actually has a bedroom, a bath, and a kitchen. And then we have our own separate room for our body interact table. So I'm going to tell you a little bit about our patients and introduce you to them. So in 2002, we started off with I shouldn't say just, but we started off with mannequins and task trainers. And over the span of 18 years, we have been able to grow our patient modalities. In 2006, we were introduced to our Sim Man and our Nursing Annie with Vital Sims. So that's our high to medium fidelity scenarios, mannequins. Then in 2015, we were introduced to our virtual simulation patient. And when we started up until this point, most of our students were getting about 4 hours of simulation or simulated activity day. And we have about, I'd like to say 1,200 nursing students that go through our program in a semester. In 2016, we were followed by our simulated participant. And this participant could play any role including the patient, our clinical instructor, a family member, a friend of the family, or even a clinical another healthcare provider. So in 2018, we were able to actually offer every one of our students 2 8-hour days to come into our Sim Center. And they incorporating all of these different types of patient modalities to help them with their learning. In May 2020, we introduced the web-based version of Body Interact using student licenses. So up until this point, we really hadn't been using student licenses. And so this group of students in May were only a few of our graduating students that had graduated and finished their educational course curriculum, but we were giving them as an optional learning activity for them. So in 2015, I was first introduced to the Body Interact table. At that time, I was teaching health assessment for first-year nursing students. Now, being an emergency nurse by background, and as well as being a lifeguard and swimming instructor and a first aid and CPR, all my learnings had been through mannequins. And as soon as so I was very familiar with what mannequins can do, and I knew what learning it had for me. And so I could see very, very easily how this could be applied to our nursing program, and how it could go across many of our different programs and courses, and actually including our critical care and any of the other courses that we had. So in fact, when I first played with Body Interact, it felt like me being back in the emergency room. The adrenaline rush that I got, the excitement that I got from being there, wanting to take care of my first virtual patient was just phenomenal. And I just really wanted to be able to share that excitement with my students, and hoped that they would be able to at least have some kind of excitement, maybe not quite as much as mine, but at least hopefully some. Anyway, as we started to using the table with our learners, we realized that we really needed to do some research to really figure out exactly what our students thought of Body Interact. We conducted a usability study, as this was our new first time using for delivering simulations. The students had very little difficulty in using this type of simulator, and they felt it was very appropriate and suitable for their learning. Our second study was a comparison of Body Interact table, which is our virtual patient, to our SimMan, which is our human patient simulator. Our findings indicated that both simulators should be used, as they're both were valuable to student learning, but in different ways. So how do we use Body Interact? Prior to COVID-19, the table version was being used to augment our clinical practice courses. And our programs were our personal support worker programs, our practical nursing program, which is a two-year degree, two-year diploma certificate, and our registered practical nurses who were coming back to upgrade to be able to go into our nursing degree program. Each one of them received 2 hours of Body Interact with scenarios that were appropriate to the learner level. Then in mid-March, COVID hit and all of our classes ended up having to move online. Our classes campus was closed, our classes had to move online, our clinical was canceled, so there was no access into our clinical for hands-on. And because our campus was closed, we actually couldn't even use our Body Interact table. And we had no student licenses. So our end of our school for the clinical, their clinical instructors actually used case studies to augment the clinical practice at that time. And we we usually have a semester that starts in May, but we couldn't because our campus was still closed. And we had some students who were left over, or not left over, we had some students who were finished graduating. They had successfully completed their program, were about to write their exams. And lo and behold, we had this ability to take a student license for 30-day free trial. So my colleague and I decided that maybe we could find some of these students who just graduated, offer them some opportunity to maybe give a trial for this, and then we could maybe have some idea and indication of how students would do with this and what their thoughts were about this. And so what we did is we set up so it was voluntary. We ended up setting up modules, 5 modules, and within each module we had 2 or 3 3 to 6 scenarios within each module. We allowed the students to have about a week to go through the various scenarios. And then we had the ability to take a look and see where they were. And then we facilitated about 4 sessions of synchronous sessions in which we actually worked through with the students on scenarios that either they did not complete or have a chance to complete because they had other things going on, or that we found that was very difficult, was very challenging for them. So these were synchronous activities. The instructor shared her screen very much like we're doing here, and they worked together as a team to try and take care of their patient. What it allowed us to do, though, it allows us to stop and start. It allowed us to actually pause, ask the students, what do you know? What was missing? What thought was going on with them right now? What did they think was going on with this client? Why did they choose that particular intervention or that medication? What were they missing and where did they want to go? And so that's how we facilitated the session with them. When the scenario was over, we reviewed the timeline and the performance report, which helped the students understand why certain interventions were first or second priority and how those priorities link back to the client's condition. And remember, these students were actually preparing to write their exam too as well. So I'm just letting you know that up front now, because we're going to talk about that in a little bit later. So in September, this current semester, we have all of our practical nursing students, again, about, well, our numbers are a little bit down, but I would say about 1,000 students who are actually doing the web version of Body Interact. It's instructor-led. They have a 4-hour session, synchronous session, and we work through 3 to 4 scenarios. These scenarios chosen are level to the stage that they're in at their program, and we facilitate the session. We again do just like we did in May. We work through the scenario with them. They have no access to these scenarios beforehand, so they're coming in kind of cold. So the scenarios that they're getting are based on content that they've already had, because we want them to be able to apply their knowledge to that. And again, we talk to them about, where they're going to go, what's going to happen. We also do the timeline, the performance, and the knowledge competencies that are offered through the Body Interact platform. In addition, we also advise the students on how to link the sessions to their course and program outcomes, as well as to their entry to practice competencies, because once they graduate, they actually, when they finish, they actually have to go in with a set of competencies that they're ready to go. So now that I've shared how we use our virtual patients, I'd like to share with you what benefits we discovered. So Body Interact for us, for the students, found it was easy for our students to learn, as well as for our nursing faculty and our clinical instructors who actually facilitated our in-person Body Interact sessions, but also we also have students that are faculty who are new to Body Interact that are currently using our web version. And so they also found that very easy to learn. Our students like that they can visualize the changes, such as fluctuating vital signs, the cyanosis and diaphoresis, or hear the labored breathing or the wheezes, saying it's just like clinical. So for those students that had the opportunity to have clinical, that's what they're saying. It's just like clinical. Using the virtual patients provide opportunities for students to care for clients that they do not have in their clinical environments, such as pregnancy and pediatrics. I don't know about the rest of the world, but we are struggling very much to find placements for those particular clinical placements for those particular areas. The students like that they can actually see how well they did from the performance checklist. And they also like the facilitated sessions to help them understand rationales and be able to link theory to practice. They consistently are asking for more sessions. They're consistently saying that it is, engaging, and they like to work together as a team. In January 2020, George Brown College was one of 11 institutions that participated in a global Body Interact study. The participants completed a pre and post Interact questionnaire. Although the study is complete and the data has only recently been analyzed, I'm not ready for the write-up yet. So I'm only going to share a little bit of stuff with you, not the whole thing, because I'd like to be able to actually write it up and publish it. But what I will share with you is that from the pair-T test analysis that was done, that Body Interact helped our learners identify their knowledge gaps with a p-value of 0.031. They learned from their clinical decision mistakes with a p-value of 0.022, and that it is an effective learning tool with a p-value of 0.011. So what I find very, very interesting is this. The students in May 2020 told us that Body Interact helped them to identify their knowledge gaps, that it was a good review for preparation to write their licensure exam. In addition, they liked having their own license because they could do the scenarios as often as they wanted, but they also liked the facilitated sessions because it helped them understand rationales and link to theory practice. However, the feedback we got in May 2020 from our students had happened prior to and was given to us prior to us actually getting the results from the data analysis. And so this tells me that the virtual patient simulator, Body Interact, seems to be a very good learning tool for our nursing students, and that we need to continue to use it. So currently in September 2020, here's what the students said. We're not doing, this is just a random kind of questions that our simulators, the simulationists have asked our students. Tell us what you think, because this is the first time we're doing fully online. And we really kind of want to know what they're feeling and how, and what they're feeling. And, you know, what do they think about this? So all of our nursing courses are virtual, including clinical, due to COVID-19. The only students that are actually going into any type of clinical is our graduating students who will be graduating in December of this year. Their placements are in, some of them are in hospital, long-term care, community settings, but some of the students are not even getting it. And even if they are getting clinical placements, it's a little bit shorter. So for those students that are in our our first year of their program are not having any clinical at all. So the only experience they're having is online. So again, all of these students, regardless of whether in semester 2, 3, or 4 of a two-year program, are actually saying they love their Body Interact experience. Most students really like the COVID case, as it helps them better understand why it is such a health crisis and has them more aware of the disease and its implications for health and safety. The students like the interactivity and the real-time responses. They feel it's helping them make connections between theory, assessment, patho, and the practice courses. They would like to use it on their own and at home, and they like the facilitated sessions, and they like working as a team. So this is all very, very exciting. The study results, along with the student feedback, will help shape how we move forward to give students a more robust virtual clinical simulation, especially given the current pandemic. In addition, the virtual patient simulator, Body Interact, will help to provide opportunities for students to experience caring for a virtual patient in areas of pediatrics, pregnancies, and other areas where placements in a hospital is hard to find, or where there are not enough placements for the amount of students that we have who are in need of placements. So in summary, here's what I can tell you, why we need the benefit of introducing virtual patients at an early stage of learning. This is from my perspective and what I can see. It reinforces their learning at the appropriate learner level in a step-by-step fashion. In other words, we can initially start with the dialogue, get the students used to asking questions, giving each group of students a different virtual patient, and then can add in the monitoring and then the physical exam as the student progresses through their program. We can repeat the scenario repeatedly until they master what they have. The added benefit is that students can provide, the other benefit is that it provides students with an opportunity to care for their patients while at home or in person, individually or in groups. So that ends my presentation. My references and information are, there's my references and there's my contact information if anybody wants to contact me outside of this. Thank you very much.
Thank you so much, Ms. Lorraine. That's, again, another wonderful presentation. And the fact that you presented at the start, the way that evolved in your institution since 2002 until now, it reminds me when authors defend that if society changes, education has to follow it. And in your explanation clearly proves that it has to be like that. And your presentation validates this and validates the importance of introducing in this, obviously, according with our session, the importance of introducing virtual patients. So thank you very much. And I'm very, proud, that Body Interact contribute in both ways, back in 2012 and 15, and now, more recently with COVID. So thank you very much. I will now pass the session to Dr. Carlos Aguilar, to share his experience as well with us. So thank you very much and welcome. Oh, We cannot hear you now.
You hear me now?
Yes, we can hear you. Thank you.
That's the mic.
The microphone.
Yeah, thank you for the invitation. It's an honor being here. I will start my presentation with context about my work in the country. First of all, I have no conflict of interest there. I, however, recognize.
Professor Carlos Aguilar, we
Yes.
can probably try to don't use the headset because I believe the sound it's not, we cannot understand everything.
Okay, can you hear me better this way?
Yes, right now it's
Perfect.
wonderful. Okay,
Yeah.
thank you very much.
Sorry, so it's the headset. Well, I was saying I have no conflict of interest to declare, but however, I recognize I'm actually working for two institutions here in Mexico. I'm working with the National Autonomous University, the UNAM, as a chief of the simulation center in the postgraduate division. It's the largest public university in the country. And I work with UVM, the University of Valley of Mexico, as the director of medicine and dentistry schools and all of its infrastructure here. So the example that we are going to share to you today is at Universidad del Valle de Mexico at UVM, which here is the UVM context. I invite you to center your attention to this little map. All the red spots are different campuses we have all over the country. We have 26 health sciences schools all over the country. And the red ones, the red dots, are the 11 medicine schools in which we are conducting this learning experience with virtual patients. These 11 medicine schools have around 7,000 medicine students nowadays, in which we are implemented these virtual experiences. Why are we implemented this innovation learning experience for our students? It's because from its very root, the university has this educational model in which we are trying to go ahead with innovation, with technology, with international experiences for our students, a multidisciplinary or interdisciplinary experiences as well, and also center very much in the a competency learning based. So our educational model has the student in the center. And with that in mind, I have a memory picture here from 2004, in which UVM started its first simulation center in the country. We were the second simulation center in the country to establish here in Mexico. So we have learned a lot in all those years of experiences. So this old picture that you can see all pixelated, it's because it's kind of old. So we, with this in mind, we trust so much in these virtual patients and these education technologies. We have been working with Body Interact since I believe it's been already 4 years now. So we designed this learning cycle that we use in our clinical experiences for the students. So first they go to the theoretical contents, all the conferences, the classroom sessions, and then we have some skills development training if it's necessary, for example, for the cardiac sounds, for instance. Then we submit these students to these virtual patient experiences facilitated by a teacher, a professor. Then we go to the complex simulation experience and then to the clinical experience, also supervised and with high quality. As well, the self-assessment, the self-study time, it's important for us in this model that we designed for the clinical experiences for our students. But we have we are so comfortable and with so much confidence about these virtual patients that we are including them in the way we are teaching and the students are learning nowadays. So you can see here some pictures before COVID-19 in which the students are learning. As you can see, these experiences are all based on group learning, student-centered, technology integration. But then COVID came up and we have to act so quickly here in Mexico. The university is so large, the amount of students are so huge that we have to act very, very quickly. So we developed a plan in our friends of Body Interact helped us so much in this process. This is an Excel sheet. I know it's not a very didactical, but it shows you the work and the seriousness that we take for this problem that we were having with COVID-19. So we developed these little sheets for every and each of our clinical settings, our clinical classes, and we developed sessions in which we correlated the general objectives that each case of the virtual patients had, also with the specific learning objectives of those cases. These were provided by Body Interact directly, the specialty, and we make a match of all these cases with the learning objectives of our subjects, these specific learning objectives of our syllabus for all these clinical sessions. So we started on April with these sessions that included a web-based virtual scenario, a recommended reference for the students so they can study. And they ended with a video conference from an expert that centered all the information for this case. So we make all this effort for all our clinical classes. So you can see surgery, internal medicine, family medicine. We all go that way with our students in response to COVID-19. We have developed a delivery system that also was very successful, in which we built these national groups, for example, the surgery, the obstetrics, family medicine, etc., in which we embedded these cases and all this infrastructure that I showed you before. So we have for this emergency response teaching, the week 1, acute pancreatitis, in which the students had their information, these live sessions, and the patients, the virtual scenarios are actually living directly in the system. So the students didn't have to exit the system to load another web browser, etc. They can run the patients directly from here. And they had their information for every week for this emergency remote teaching platform that we designed for COVID-19. So every week they had a patient, a virtual patient, or a couple of patients. There are some weeks in which they had to respond or answer many patients, but they were also having this references from where they were reading and studying. At the end of the week, they had this lecture from an expert, a national expert, and this Q&A session with him. Also, we provided them with this Q&A space in the platform, so they can ask all the questions here in real time, and we have people answering their questions. And we have those for every clinical area, family medicine, for example, obstetrics, because all of our clinical sessions were canceled because of COVID-19. So that's what we have as a response, an emergency remote teaching system that we respond to COVID-19. So we learned a lot from that experience. We learned so much, and it gave us the opportunity to include some more innovation along the virtual patients. That's because nowadays our clinical scenarios are still closed because COVID-19. So we have to explore these low-cost DIY simulations at home with the students to develop some surgery skills, as you are seeing some of videos showing here. We have these CPR practices, as you can see in the picture as well, with these low-cost simulators. But a great tool that we realized we were utilizing before COVID-19 was the virtual patients body interact. We realized we can develop not only this knowledge or thinking abilities, they actually develop skills like the ones we're seeing here with the exploration of the cardiac sounds, the analysis for the labs, for the tests, the electrocardiogram as well. So we nowadays are running a special program for our students. They are not attending clinical rotations because the authorities here in Mexico are not allowing them as well. But we have this responsibility to develop these skills in our students. So we have created this whole plan in which the virtual patients body interact have been playing a nuclear role for us, and I thank the support that we are having in this great experience. So nowadays there are 3,000 students here in Mexico that are using this platform, this system that we developed for this pandemic situation, and we are having, I believe, so much success. We are making some assessment for the students. It's regular assessment basis are with these strategies. We have rubrics, we have a checklist, and all that, and we are assessing the students this way as well. Finally, we are conducting a little research to know how our students are receiving all this innovation, all these new technologies. You know, Mexico do not have all the telecommunications infrastructure. All our students, they do not possess the latest smartphones or the latest PC computers. And we want to explore the other side of the coin, the students' perspective. We developed this questionnaire that we are applying to these students. We have a sample about 900 students in which we are conducting this research, and I hope to have the results very soon and publish them as well to share with you. So this was the experience that we are having with this COVID-19 response here in Mexico. thank you very much for your attention. Here is my contact information if you would like to connect. Thank you very much.
Thank you so much, Professor Carlos Aguilar. Again, a very, very good intervention and sharing your experience, particularly when you're mentioning how important it is to bring theory before, bringing virtual patients along, but as well on creating, a structure way of delivering. It's not only about having it, but how we're going to deliver it. And the tools that you share with other educators that are attending this event are very important. For example, the examples that you use with Microsoft Teams, integrating all these softwares along with your theory, with the references. So very, very good insight. And thank you very much for sharing your project and the way that you're using Body Interact among the attendees. Thank you. Last but not least, I will then pass the word to Mr. Shoal Gordon. I'm very excited as well to hear from a student perspective. And I know that you have a very interesting story with Body Interact. So I'm all ears. Thank you very much.
Well, thank you, Maria, for this very kind introduction. It's funny actually to come at the tail end of so many speakers who are much more distinguished than I am. It kind of reminds me of that story of that Polish prime minister that after a very long debate in Polish parliament, he just got up and left. And when he was asked, Mr. Prime Minister, where are you going? He said, well, everything has been said, but not everybody said it yet. So I'll just proceed to do just that. Actually, first of all, I gotta say to Tina and Lily, I'm overwhelmed by this, but by what you described. I wish that I had this opportunity when I was in school. Although knowing myself as a teenager, you probably wouldn't have accepted me, and rightfully so. But I'm not gonna talk about the advantages of simulators per se, because I mean, obviously that point has been made. But for us here, all right. So I got to know about Interact when I was in Heidelberg in a convention of the European Medical Students Association. And I got to know Rita and Raquel there because they came to present about Interact. And if you know about Interact, you probably know Rita and Raquel as well. And I was very impressed by that. I was very impressed by the software because in the past I was a combat medic in the army, and because I'm Israeli born, so what we did, the way that we prepared ourselves, the only way to prepare yourself is to constantly repeat the schemes and constantly repeat, to get to a point that when you actually have to use the skills, you don't have to think about them. And here, starting medical school, I found that aspect a bit lacking because we do so much theory that we kind of, even when we're in the hospital, it's rounds, like give me the triad of Meniere's disease and stuff like that. It's not, it's not talking to patients or being in a one-on-one situation with anybody. And it's it kind of there's a quote by Epictetus that said to his students, you may be eager and loquacious in the schools, but throw yourself out into practice and you're miserably shipwrecked. And that starting to talk to patients in fourth and fifth year, fourth year really, that was kind of the experience. Now, after we met them in Heidelberg, we really, we had the hots for the program, so we really wanted that to be incorporated into our program as well, to our school program. So there was a lot of student lobbying for that, and eventually they conceded to try it out and see how it is. And in October of last year, which honestly feels like it was 40 years ago, we had a class in emergency medicine with Professor Stefano Perlini, who's a fantastic professor in his own right. But combined with the virtual table, it was off the hook. It was a phenomenal show, and it really kind of tied everything together, because he was going about telling people how to kind of like questioning the students of like, all right, so this is the situation, what would you do? Kind of gathering ideas from the class and then implementing that on the patient. And for the first time, we could see that all the theory that we're talking about, how it's being brought into practice, and that was very useful for everybody, and the responses were really great. So after that, after that, obviously there was COVID, and I studied in Lombardia, so you can probably imagine how that was. And we were out in the water. All our professors were heavily involved with COVID patients. Always in the hospital. We pretty much didn't have anybody to talk to. We tried to volunteer ourselves to this and that, but obviously they couldn't have us in the hospital to bugger everything up. And then after a while, after about a month, where everybody were kind of trying to, I guess, run around like headless chickens, they did structure a program where we got to do body interact cases, and also clinical cases that they wrote for us. And that was for me personally, it was a very grounding experience to have that, because I love being in the hospital. I kind of need that for my development, regardless of if there's anything constructive going on there. It's just the atmosphere that helps me put the theory in real world terms, I guess. And the ability to have this kind of interaction with a virtual patient, but a patient nonetheless, was very grounding, and was very helpful to also, from a personal perspective, with the COVID quarantine experience. So I look forward to see what the future might bring with it, as far as the cooperation of the faculty with Body Interact, once normalcy resumes, and yeah, thank you for having me.
Thank you so much. Thank you for sharing your experience, particularly because it's the other way around. So you, as students, noticing, that you needed that, and for me, it's kind of a validation as well, because we tell so many times that Body Interact obviously cannot replace real patients, cannot replace mannequins, but can at least mimic the emotions that you experience, and can at least mimic the exposure in the clinical environment that you're missing so much. So I really appreciate, that kind of, testimonial.
Yeah, sure. It's like learning how to drive on a simulator. Sure, you might not leave the simulator a Formula One driver, but you'll probably look at the mirrors more when you get to the actual car.
Correct. Exactly. Thank you so much for another insightful feedback. And I will pass now on to some questions that we're having in the chat box. And as we go along to those, I will remind the other attendees if, to feel free to put more questions on the chat box. We still have time. So, let's start with the first one that it seems like is, specifically for Dr. Tina and Miss Lily Conde. Is there human factors training in the children being introduced to STEAM from grade 8 to secondary school? Because a lot of health professionals were bullied in school for declaring interest in being a doctor or STEAM professional. Are the children taught how to be human and human? Conran Buckle is asking.
That's a great question. And so I am going to let you know that part of the students that are in our campus and what makes them very unique is that they have all opted to come into our school. There is an application process because we want to make sure that they are very understanding of what the expectations are coming into the space. But I am going to pass the baton over to Ms. Conde about the human piece, because I think that's very critical. And as one of our health science teachers, she can talk to you a little bit about that piece.
Yes, so one thing that I and Mrs. Garza and I were talking about earlier is we've attended presentations with different universities, with medical schools, dental schools, and a lot of them talk about the soft skills that are missing in some students that are transitioning from secondary to post-secondary. And so it is something that we try to instill with our students early on. Our curriculum, we do a lot of basics. And so, for example, right now, I'm doing a kind of a refresher course for my seniors on laws and ethics. And so it's something that's covered early on, as early as 8th grade, and we continue to grow on what we're teaching them and what we're doing with them. And one of the best parts of what we do here is that you have healthcare professionals teaching these students. And so what we can do is turn around and share our experiences with them. And, I am very involved in what we're doing with our students. So I've shared, scenarios with them that I've personally experienced. And for our students to be able to work through specific scenarios on me sitting in a dental chair, or using me as, their practice for drawing blood or whatever it may be, it really helps with preparing them on those soft skills that is super important for any healthcare provider to have. So I hope that answers your question. Like Mrs. Garza said, our students choose to come here, and they understand fully that they're committing to this profession. Whether they continue it after they graduate or not, it's something that they commit to when they come to us. And that in itself helps a lot with that aspect of, the human factor, because they fully understand what they're getting themselves into, and their parents understand what they're getting into. So it's kind of a team effort. And like I said, one of the really amazing things is we have former healthcare professionals as educators in this setting that bring those real experiences in with them. And so we're able to share those with our students and give them, our insight and what we've experienced and what we've done.
Okay. Yeah. Thank you very much for that.
Thank you. Our next question saying, coming from Peru in Lima, from Mission Malca, asking which are the lessons learned from the challenges faced due to COVID-19 pandemics. And I would probably start by asking to Ms. Lorraine Betts, and then probably I will also ask from Professor Carlos Aguilar as well, his opinion.
So lessons learned. So one of the biggest things that I think that we have learned as an organ is that we had to move quickly. So we had to take what we have what we do very well and figure out how we can deliver it and be able to reach our students while keeping all of the good things that we know about virtual patients and simulation education, ensuring though that realizing that the way that we deliver it may not be what we were used to, but the principles are very much the same. So for instance, don't give them something they haven't been taught. You may have to spend extra time virtually. If you could do something in big groups in person, you have to think about the smaller groups and making smaller groups and going online. I'm not sure about anybody else's things, but you have to think about your student population. Where are they coming from? What are they doing? Also, from a nursing perspective, COVID-19 is an awesome type of let me rephrase this. It's not awesome to have COVID-19. What's interesting about it is that there's so much learning that can happen by actually just studying that and being able to link all of the things that happen back to the profession that they're going into. So knowing the best practice guidelines, who to talk to about World Health Organization. What does it really mean when you have these things? Why are they asking all these questions? Why is this, why do we have to isolate before we do vital signs, or let's open up an airway? And being able to have that within Body Interact, it means that my students get exposed to experience that, and we can talk about it, that will hopefully prepare them for when they actually do get into clinical and make them think about the things that we're going. So for me, it was actually about doing what we do best and how can we quickly do it, but not so quickly that we compromise our education. So I was grateful that our students, our college closed our campus and didn't do an intake in May, because it allowed us to think about what plan we had. The other lesson learned is that don't do it by yourself. Make sure you have somebody else with you. Have the key stakeholders in whatever you do. I think that's true no matter what you're doing, but especially when you're dealing with something that's brand new. So delivering online virtually, regardless of whether it's simulation or education, was totally new to our school for a lot of our faculty. So making sure you have somebody else. I'm not sure if I answered all of that, but those for me were the biggest lessons. Keep what you know that you're going to make mistakes. Try and be bendable and flexible enough to be able to make the changes, get the feedback in the moment and make the changes, share them with the people and make the changes that you won't compromise your curriculum or what you know works for students.
Perfect, thank you. Professor Carlos Aguilar, would you like to give your feedback from your experience?
Yes, thank you. We learned that we were not ready. We were not prepared for such this challenge with COVID-19. We were so far from being ready because here in Mexico, the medical schools are so traditional still. They have very much trouble going forward with these new educational technologies. Just nowadays, simulation still is some challenge to implement in some schools here in Mexico because these traditional learning settings that we have. So imagine from one day to another, we had to migrate 17,000 students from health sciences from fully presential programs to fully online. So the amount of work behind that and the amount of training needed for all the professors, all the teachers, and the students as well, because being such a traditional program, the expectation that the student had was also of a traditional program. So we are struggling still with those paradigms of learning. So we are still discovering how to approach better the students because of these traditional settings here in Mexico. So my recommendation, my learning experiences in this is that, as Lorraine also said, that you do not have to do it yourself. You have to surround yourself with professionals. If needed, you can include in your team a technologist and a educational technology leader is very important, because we are not expert in all the new innovations and technologies, and we are not that expert. We are clinicians in most cases, and being with the right people is such a game changer, I believe.
Thank you very much. Dr. Garza, knowing that you also have so many students from different grades and knowing your experience on combining them on the learning purpose, what were the challenges for you as well? I think would be important as well for educators from high schools that are, here attending the event.
We're doing the same, very similar things that we had already started with learning management systems at our campus, just because of the size and migrating students, of course, for us for the post-secondary experience. But now Body Interact and all of these virtual opportunities that we had, not initially, and I agree with Dr. Aguilar, that we had not really implemented them as well as we could have, and now being pushed into this new space has really broadened our horizons. We are all brand new teachers again. Everyone is a brand new teacher this year, because we are in a very different setting. Our students are in a very different setting. They're learning to be more independent on their own. An 8th grader, and I'm going to tell you, our numbers in our space that we are currently hosting is very minimal. We're about 25% capacity in our space, but a majority of the students that are here are the 8th and the 9th graders who have not started to quite learn how to mitigate all of these responsibilities that now they're having to face, on top of the virtual learning that they're doing. So our upperclassmen, again, thanks to Ms. Conde and all of the team that we have working with them, have really done an outstanding job of putting those particular skills in place for them. But utilizing the resources that you have is very critical. And I think that we need to be open to learning. We need to be willing to bring partners like Body Interact in and learn how to utilize those pieces. And I love Lorraine's comment, we do not need to sacrifice what we know the students need to learn. It's just the delivery piece that looks different. And I think that's where we as the leaders need to learn to be flexible, and we are the role models, right? And so I think that that's very powerful, that we are now looking, and here we are, across the world. And here we are looking and collaborating as we continue to prepare individuals to go out into this undetermined space. We don't know what it will look like. Students ask me, Mrs. Garza, is this going to be over in a few months? And I don't have an answer for them. We don't know what that looks like. And I said, but regardless of where we're at, we'll be together. And so I think that's the reassurance that we try and give our students, our parents, our community, all of our community members that work with us, because our goal is to prepare students to be on this path that we eventually will bring them out into the end of, and hopefully a very promising career where they are impactful and hopefully, help mitigate all this for us. So.
Thank you. Thank you very much. I think we still have a couple of minutes for 1 or 2 more questions, if I'm being too optimistic, because we have now lots of questions here. I'm going to ask Professor Carlos Aguilar. Peter is asking, what's the timeline for the clinical training simulator geared towards medical students? I would assume that when exactly in the curriculum, it's important to, and obviously asking as well, it will be targeted to learning institutions or individual students. If you would like to answer that one.
Yes, our curriculum, our program is, we have the simulation learning experiences from day one. In first semester and each semester ahead, they had this subject in which they train the basis of the clinical exploration, the clinical record, how to make this interview, and all this practice. So from day one to the middle of the career, in 5th semester, they are only at the simulation center learning the basics. Then they have this integration module in which they have to prove themselves with a real patient in one of our clinics. We have some clinics in the country, UVM clinics, I mean. We run those clinics. So these like freshman students that have been already proven themselves in simulation, now they go to this very controlled clinical environment in which they prove their skills with real patients and very good supervision. Now, from 6th semester and ahead, they can go safely to the clinical settings that we do not administer, which are these public hospitals, these private hospitals around the country, because we have now been certain that they have the basis, good basis, and we can make them learn better in the clinical scenario. So it's established this way. 5 semesters, they are only simulation all time, all day. Then this integration model in which we have very supervised clinical practice in one of our clinics. And then we can like give them this check, you are okay to go to external clinical practices because we have been certain that you have the clinical basis needed to do that.
Thank you so much. Final question before the wrap up. This one to our student, Joel Gordon. Julia from Dresda is asking, how did you manage to bring Body Interact to your university?
All right. So Julia, thanks for the question. From Dresden, Hungary, I would imagine. Yeah, no, Dresda. Anyway, all right. Well, we just asked the faculty and just kept on asking until they said yes, basically. That was it. It did. Raquel and Rita came by in October, I think. I think it was, yeah. And they also presented it to the dean of our faculty, who killed a patient, so he wasn't that impressed at first. But yeah, I mean, they warmed up to it, and after there was a week-long trial in the university that was coordinated with Body Interact, where we had the students come in and have a competition, and write down their impressions and write down their feedback, which was very, 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 very positive. And I think the faculty was just convinced by that. Let alone the fact that, you know, once COVID-19 hit, there was really no way around it. So yeah, so I mean, I guess it was a combination of factors, which, you know, they warmed up to it before COVID hit, obviously, but Italy, like similar to Mexico, I would imagine, is has a very, very traditional way of teaching. So yeah, it's kind of it takes a bit of persuasion, but eventually it happens.
But there was a yes. Thank you very much. Great. Thank you everyone for attending. I will now pass the word to Silverio. Thank you. Oh, you're mute. You're mute.
So thank you very much, Maria. I'm just only give an answer to Peter because Peter asked another question that it's more clarified for us, that is related to when the Body Interact is available. Body Interact is available right now. Since 7 years ago. It's ready to use. We are now covering 18 therapeutic areas, and you can use Body Interact anytime, anywhere that you would like to use, for the teachers, for the learners, and also for the educators. I would like to thank you very much to all the people that participate in the Learning Lab. I have here some ideas that I will share with all the attendees and also all the speakers. It was an amazing and remarkable session. For example, from Dr. Tina Garza and also from Dr. Lily Conde, I have the idea that the body interact complements the strategy of balancing between the academics and also the social emotion development, because the simulation is also the emotion. It is lovely to see how it is used by kids of 5th grade to many other grades. It is amazing for us. You also share with us the idea about the stress, the pressure, how to help the learning curve of the students. And this life real pressure, it also makes all the sense. And this, from basic level to the advanced level, it also works also with the 4 C's that you also shared. And one idea that I got here, it is the amazing word that you tell that all the teachers that year were brand new teachers. And this is true. All the teachers were brand new teachers, but I see that all were leaders and also pioneers. I would like also to underline the intervention from Professor Lorraine Betts, sharing with us the information regarding 2002 until 2020, when they start using on 2015, because it was a pioneer that started using in 2015. I remember in the iMessage event when we met, and it was amazing. And you make this history all. Review the timeline, the performance report, the debriefing to prepare the exam. During the COVID, how you used also sharing the license with the students. The benefits, easy and fun, the visual signs, working together as a team, engaging, all the research that you are making. Thank you very much for being pioneer. Regarding Professor Carlos Aguilar, it is a pleasure also to see the historical records since 2004 until today. The learning cycle from the theoretical to practical way, and the way that you also design the learning experience using the body interact. It is a very good example in this new area, the COVID-19. And you also, let me also underline another expression that you gave us, that is the emergency remote teaching system that you need to adopt and you need also to implement. And it was an amazing way that you implement in a very complex institution, how you made a very friendly transition. Don't forget it, the students, and also don't forgetting also the educators. We are curious about the research that you made with the students to check the results, and regarding our students from this digital learning generation, I would like to underline that you gave us the claims that we have, because you talked about moving from a passive way to learn to an experiential way to learn, and you also consider that the body interact is the learning accelerator. And we are very proud of having all of you inside this session, sharing the best practice in this new area and also outside this new area. For us, it was a pleasure, and I believe that the 109 attendees that we had, they were also very happy to learn all this very good experience that you made with the virtual patients.
Thank you so much, everyone. It was a real pleasure.